My hands are
This
tired. You didn't
one.
have holding anything.
All right. See if I can spread this out a bit. Start.
I need a little break.
All right, ready? Okay, so we'll go over the arterial system first. So you can see this big arching structure is the aorta coming off of the heart. So the first branch is going to be your brachiocephalic artery, which I think that's distinct here. There's a bit of connective tissue on there, but that first branch, that's the brachiocephalic trunk/artery. And mammals only have one of these in the arterial system. And if we pull this vein to the side, you can see where it branches here. This is going to be your, or rather the cat's right subclavian artery. And this branch going straight up is going to be the right common carotid. So again, for the arterial system, this is the only one that we're going to hold you to the left and right for because there is this asymmetry here. Then if we push this to the side, so they didn't really get the chance to clear off this shoulder, but that right subclavian, that's going to lead into the right axillary, and then once you get into the arm, that's the right branchial. It is cleared off on this side, so we'll go ahead and trace them here. But first, let's get to the second branch off that aorta. This is going to be the left common carotid. So you got the right common carotid here, and then the left common carotid. Then this final branch, that's going to be nice and distinct, is going to be your left subclavian artery. And that, if you follow this guy up, so you can see as soon as it passes out of the thoracic cavity, so here's the rib there, then it becomes the axillary artery. And then following that, even deeper into the arm. So like kind of once we pass this shoulder area, then, sorry, the vein is on top of it, then it's going to become the branchial artery. Or brachial, not branchial, sorry. So that's the arterial system. For the venous system, I didn't really clear the back of the heart here, but you can see the superior or anterior vena cava here. It's this nice, really big, thick blue vein. And then you can see we've got some connective tissue here, so that's not a split, that's just where it is. All right, so it's gonna, I think actually this is gonna be the first split here. It's gonna split into two brachiocephalic veins. So this is one that can be a little bit variable depending on the specimen. So I've seen some that have like really, really short superior vena cava and the splits all the way down here. And then we've got some where the splits like all the way up here. So this is where knowing the branching pattern is going to be a better determinant than knowing like specifically where in the chest the pin might be. So we've got this first split here, and I'll go ahead and follow it on this side. Then the brachiocephalic vein is going to split into jugular. So on the cats, you can just say jugular. We've got internal and external on the anatomage, so just make sure you check that out. And then, so that's going up into the head. And then this branch here, this is going to be our subclavian vein. It's a really short subclavian vein before you reach the axillary vein. And then if you keep following that into the arm, that's going to be the brachial vein. Yeah, so that's the venous system. This cat has it cleared away all into the shoulder. The other cat, we haven't done that, but you can see especially this aortic branching system really well. So just make sure that you review that on that other cat.